Hello, my name is John Murray. I'm an advanced practitioner in bone marrow transplant and haematology working at the Christie Hospital. I'm going to talk to you today about stem cell transplantation in lymphoma. What are stem cells? Stem cells are immature cells that are found inside your bone marrow. There are many ways of thinking of stem cells. I try and give people a description of something else because I tend to find medical terms are quite complicated sometimes. So one of the things I describe to people is think of your stem cells and your bone marrow space as a garden. And your garden are the bones. And in your garden, you've got soil. And inside the soil is essentially your stroma, which is the layer inside your bones. And that's where your bone marrow is growing. And inside that soil are seeds. And those seeds start to grow and develop. And as they grow and get bigger and bigger, they eventually grow stems. And out of those stems grow flower heads. And it might be that one flower head is red, and that could represent a red blood cell. Another flower head is white, and that could represent a white blood cell. And another flower head is yellow, and that could represent a platelet. And if you think about that whole garden structure, the soil inside of it, the seeds, and how all of those flowers develop eventually, that is the stem cell process. Those cells are living inside your bone marrow space, and they're growing and dividing, and they all start from one seed and that one cell. And it eventually blooms and comes out into your bone marrow. So it's a nice, easy way of thinking about it rather than getting all complicated thinking of cell development and how they grow and divide and develop and eventually get into your bone marrow space. So that's an easy one to take away with you. Why do we want to do a stem cell transplant? So it might be that your lymphoma is of a high risk category, or it might be that your lymphoma has come back very quickly after some initial treatment, or it might be that your lymphoma has not responded to your initial treatment. So a stem cell transplant might be the thing that is decided by your team that is the next step for you to take in your treatment journey. And that transplant might be either an autologous transplant or an allogeneic stem cell transplant. And the difference between the two, auto means self, so those cells are harvested from you, and allo means somebody else. So those cells are going to be harvested from a donor, and that donor could be a brother or a sister, or it could even be somebody completely unrelated on one of the bone marrow donor registries. If we think about an autologous transplant, there are several steps to the preparation for that as the patient. So you're given conditioning or mobilization chemotherapy that encourages those seeds, those stem cells to come out of the bone marrow space and start to float around inside your bloodstream. And we can then harvest those cells or collect them and put them into a bag and put those into a freezer and keep them there for a week, 2 weeks, a month, even longer. We bring you back in. You're given more chemotherapy to allow the stem cells then to be reinfused and start to grow back inside your bone marrow space and repopulate your marrow. And these stem cells that have been harvested are nice, clean, healthy stem cells that we're going to put back in after you've had some chemotherapy, which is allowing your disease to be treated with a higher dose chemotherapy, and we're rescuing your bone marrow with these cells that you've been harvested and collected and put into a bag. For an allogeneic stem cell transplant, it's a similar process, except you are not donating the cells, it's now somebody else. So this could be a brother or a sister, or somebody, as I say, that's completely unrelated to you. The process for you is similar, that you'll come into hospital, you'll have some chemotherapy, there's conditioning, and then the cells, wherever they've been harvested from, whether that's in the center that you're at or somewhere else, they'll be transported across, and those cells will then be transplanted into you through a drip, usually through your central line or a very large peripheral cannula, or maybe even your PICC line. And those cells then start to grow and divide again inside your bone marrow space and get into your bloodstream and recover your blood counts. Now, for both processes, you'll be in hospital for around about 2 or 3 weeks. And that's very much dependent on how quickly the cells grow back and can be influenced by things like infections. And sometimes if the cell count is a little bit lower that has been harvested, that can take a little bit longer for those cells to grow back in. But as a ballpark, most people are in for 2 to 3 weeks. Once you've then been in for that period of time and the cells have started to engraft and grow, people are then looking at your blood count every day and hoping that you're going to be discharged fairly soon, and plans will be made for your discharge to get you out of hospital. You'll then be followed up in clinic, and depending on which kind of transplant you've had and the centre that you're at, you'll be followed up for a number of weeks on a weekly basis on site, or you may then eventually transfer your care back to the centre that you came from. And the recovery from the autologous transplant can take people several months, and that's often a surprise because most people have been through rounds of chemotherapy before and they think, oh, it's just going to be a week or two and I'll be right as rain. It can take you several months and even up to 6 months to recover from an autologous transplant. For those patients that are having an allogeneic stem cell transplant, it can be upwards of a year to recover from this kind of transplant. It just takes a lot longer. It's a lengthier process. It can be harder on your body and therefore longer for you to recover from this. There are complications that can be associated with an allogeneic stem cell transplant that are slightly different to the auto transplant. And if you look on the Lymphoma Action website, you can see some information around graft versus host disease, and we're not going to discuss that here today. You, as a patient, might be thinking, oh, well, which one of these two am I going to have? And this is very dependent upon the kind of disease you have and how you've responded to previous treatments. And this discussion will be had with you by your treating team in the centre that you are at. And this can be sometimes quite a lengthy and protracted conversation with lots of ifs and buts. But it's one that will be revisited with you on several occasions to decide what is the correct treatment that is being offered to you, and then you can help the team decide which one you think is more appropriate. It's not always a black and white answer. Sometimes there is a bit of a grey area between where that comes down to a decision between you and the team. But there are some diseases where it's absolutely the best thing to do first is the auto transplant. This is less toxic and gives you less problems in the post-transplant setting. But there are some occasions where the allogeneic stem cell transplant is the first option. But both of these options will be discussed with you in the clinic with your treating team.